Hi, my name is Jason. Today I'm going to talk about therapeutic drug monitoring of phenytoin. Phenytoin is indicated for epilepsy and seizure, and this medication works by preventing repetitive neuronal discharge. Let's talk a little bit more about pharmacokinetic profile. In general, the half-life of phenytoin is about 22 hours. Phenytoin is about 90% protein-bound. It is metabolized by liver and is excreted in urine as glucuronide conjugate. We'll talk more about this later. Now let's talk about when and why therapeutic drug monitoring is used for phenytoin. We do therapeutic drug monitoring for phenytoin when it is newly started medication, suspected non-compliance, breakthrough seizures, after dose adjustment, and suspected phenytoin toxicity. Once patient is stable on phenytoin, patient should monitor every 3 to 12 months unless any situation affecting the pharmacokinetics of phenytoin, which require more regular monitoring. We do drug monitoring of phenytoin because it has a narrow therapeutic index, which means the risk of toxicity and other treatment is high. Besides, the highly protein-bound has many drug interactions, could be affected by many medical conditions, and has a non-linear pharmacokinetics. For this reason, monitoring phenytoin level is clinically valuable to ensure therapeutic efficacy in individual patients. For optimal control of medication, targeted concentration of total phenytoin is between 10 to 20 mg per liter, and the free phenytoin level is between 1 to 2 mg per liter. If the level exceeding the range, toxicity or other treatment might occur. Total phenytoin serum concentration is a mainstream way for routine therapeutic drug monitoring purposes. However, free phenytoin serum concentration monitoring is restricted to patients that have altered drug plasma protein binding. These are some of the toxicity that might expect if the level of total plasma phenytoin concentration go above the range. Here are just some studies showing that total phenytoin serum concentration is not a reliable therapeutic goal for drug monitoring with individuals with hypoalbuminemia, which commonly caused by renal failure, hepatic failure, and malnutrition. Total phenytoin serum concentration is also not accurate in neonate, pregnant patients, patients with uremia, and patients with acute trauma. In this case, measuring free phenytoin would be appropriate for this patient to avoid toxicity and stay within the therapeutic range. This is another study of the concentration of phenytoin from clinical challenges in therapeutic drug monitoring. Phenytoin is about 90% protein-bound. Free phenytoin level may be altered in patients with some disease, states, and conditions. Protein-bound may be altered if there's insufficient albumin concentration as well as displacement by endogenous and exogenous compounds. I have listed down some of the examples in this slide. Patients in this category, total phenytoin concentration may within the therapeutic range, but the level of free phenytoin may exceed the recommended range and therefore causing a toxicity. The presence of hypoalbuminemia is known to reduce the protein binding of phenytoin in plasma, and both of the ratio of free and total phenytoin concentration may be altered. By using the formula in this slide, the proportion of the bound drug will decrease in the presence of hypoalbuminemia, which lead to an increase in proportion of free drug. When phenytoin gets displaced, the total drug concentration will be decreased. This is due to more of the bound phenytoin got pushed out of the protein complex and becoming free drug. Some conditions like liver disease and drug interaction will affect the CYP enzyme, which lead to increase of the free phenytoin. The concentration of the free drug will increase and will soon be eliminated out from the system, leaving similar concentration of free drug as before, but reduced total concentration of phenytoin. If we keep dosing the patient according to the total concentration of the phenytoin, the free drug will exceed the recommended dose and will cause toxicity to the patient. Therefore, we need to monitor the free drug and not the total concentration of phenytoin in this case, because only the free drug can distribute into the tissue and exert an effect. Dose adjustment is needed for these people with those disease and conditions, and regular monitoring would be required. Thank you.